The Minnesota State Retiree Council, AFL-CIO, is pleased to have Tom Beer with us today. Tom is the president of the Minneapolis Regional Retiree Council, AFL-CIO. And the topic today is Medicare. Medicare has four parts, cleverly called A, B, C, and D. Tom, could you explain quickly what those four parts do?
That's right, Dan. Part A of Medicare is hospitalization coverage, basically. Part B is doctor's visits. Part C is so-called Medicare Advantage program. That's private insurance that individual Medicare recipients can opt for. And Part D is pharmacies, drugs coverage.
What costs are involved in Medicare? What are some of the dollar and cent figures?
Well, the costs vary, and who pays varies. There's a discussion now about Medicare for all, which Bernie Sanders, for example, has been talking about. Basically, that would put us in a situation where the federal government would pay through our tax contributions for all medical coverage. It's currently not what we have. We have a very mixed system. Depending on what you need under Medicare, and 99% of people 65 years or older are covered by Medicare now, so Medicare really represents, for that age group, universal coverage. But depending on what you need, it's going to be paid for as a cost by taxes or general revenue, or by the individual themselves. One of the most unfortunate aspects of coverage today is that the private pharmaceutical industry basically has got a hammerlock on the cost of drugs and pharmacy, and that has led to such odd things as the donut hole. And the donut hole, which is there, means that people who have pharmacy costs of over $4,000 a year and something less than $8,000 a year have to pay considerably more of those costs before they get any reduction.
Tom, what has been the impact of the Affordable Care Act, which is commonly called Obamacare? Has the Affordable Care Act made a difference?
Well, the Affordable Care Act that's been in place now for approximately half a dozen years, it was designed, among other things, to rein in some of the private sector costs that are out there without creating universal health care like other industrialized countries have, which I hope is what we're going to ultimately move towards. But the system as it is has high administrative costs that the Affordable Care Act has helped to rein in. Medicare administered by the government, those parts administered by the government, has a low overhead. The cost of private sector administration of various parts of the Medicare program are as high still as 13% of overall costs, whereas Medicare comparably is in the single digits. The Affordable Care Act has brought down the administrative costs and the overall cost of private sector health care, but it's still high. And I think until we achieve a uniform and singly administered system, we're not going to see reductions of that type. Plus, the private market still controls a huge part of Medicare expenditures in private sector insurance, the Medicare Advantage program, and in drugs.
Will the 2016 elections make a difference insofar as Medicare is concerned?
2016 election, I think we should be optimistic. We have seen the debate shift dramatically in the area of changes needed in Social Security. The candidates for office are talking about Social Security because they really can't dodge the issue anymore. I think the same dynamic is there for health care, but still we're probably in a situation where the changes in a positive way to lower costs, cover more people, and to squeeze private for-profit healthcare out of the system are going to be happening at state levels, I think. I'd like to see that there is a debate, and I think those of us in labor and consumer advocates that are concerned about this issue need to raise the issue of Medicare changes so that there is that debate within this campaign period. And hopefully we can move another step towards that. Some feel that the Affordable Care Act has achieved enough. I don't believe it has. I think we continue to need to move towards single-payer health care for all, so that we can at some point say that we also have 99% coverage for the people who are under 65 years of age, which isn't the case now.
Thank you, Tom Beer, President of the Minneapolis Regional Retiree Council, AFL-CIO, for your thoughts on Medicare. I feel much better informed now.